The goal of this snippet is to provide tips on how you can incorporate quality improvement into daily teachings. Program directors and faculty actually doing the teaching will find this information valuable. However, this information is also beneficial for others involved in GME, such as DIOs and coordinators, because they too need to have an understanding of how to integrate quality improvement into residency education. The ACGME has incorporated quality improvement and patient safety into the requirements, and the CLEAR program provides even more structure for sponsoring institutions on what institutions and residency programs should focus on. Think of these as your blueprint, your guide, a place to start when developing quality improvement educational programs for your residents. Most of us who have been working in healthcare have seen the evolution of quality improvement and patient safety in all aspects of healthcare. There are patient safety officers, quality improvement and patient safety committees, risk assessment teams, all part of standard hospital operations now. And GME is involved in this evolution. GME curriculums have been adapting to include some formal education on quality improvement methodologies and patient safety, and it's very important that they do because residency may very well be the first time that physicians in training are exposed to quality improvement in healthcare and putting it into practice. So it's crucial that GME programs are prepared to deliver this education to residents. Defining and understanding what is meant by quality improvement will help you to be able to incorporate QI into daily teachings. The basic definition of quality improvement is a formal approach to the analysis of performance and systematic efforts to improve it. PDCA, Plan, Do, Check, Act, is a very common QI methodology that's used. Usually, though, a QI methodology is employed over some time period, and that doesn't exactly align with incorporating QI into daily activities and teachings. So let's look at another description. The Health Resources and Services Administration, HRSA, states that quality improvement consists of systematic and continuous actions that lead to measurable improvement in healthcare services and the health status of targeted patient groups. So I want to emphasize the terms systematic and continuous actions here. Incorporating QI into daily teachings is a systematic and continuous action, which reinforces QI concepts and education given more formally. Many programs are already incorporating QI education into their didactics. But if residents are not using and applying this knowledge learned, then they likely won't remember what it is they learned and then how to use it. So this is why incorporating QI into daily teachings is important. A large part of the success of incorporating QI into daily teachings may also depend on the organizational culture of your sponsoring institution and whether the faculty teaching your residents have the knowledge and skill set to do this. Organizational culture may be a challenge, especially if your sponsoring institution is fairly early on in integrating and formalizing QI concepts into organizational processes. This can also make it more difficult for faculty who are mentoring and teaching residents, but GME leadership and program directors can still take this into their hands and have an impact. So let's get down to it, 5 ways to incorporate quality improvement into daily teachings and activities. Number 1, make the connection. This also may be the most important of them all. We need to get residents into a quality improvement mindset and have them start making the connection between simple things, everyday tasks and responsibilities, and quality improvement. So for example, reconciling medication list, an everyday responsibility that is intended to deliver safer care and improve patient outcomes. Residents may not realize it, but this is a quality improvement activity. If you take this a step further, your organization should have QI and patient safety priorities. After identifying those priorities, some QI methodology has likely been employed to improve organizational performance in the identified areas. as part of the QI methodology, there's some practice, protocol, or guideline that has affected or changed the work of residents. So here's an example. Your organization wants to improve early identification of patients who may have had a stroke so that medication can be given to these patients in order to break up the clot and improve patient outcomes. So the organization has developed a checklist for clinicians in order to aid in this early identification. So residents, as well as other clinicians at the organization, are now using this checklist and are involved in this organizational quality improvement activity. Residents may not actually realize that they are part of a larger organizational quality improvement process. Just making the connection for them that this is a QI initiative and they are a part of it can help them to start thinking beyond the task and looking towards the bigger picture of improving quality of care. It's kind of like that question on the ACGME resident survey about residents identifying whether they've actually participated in any QI or patient safety initiatives. You may get the results of the survey back and see that a less than desirable percentage of your residents indicated that, yes, they did participate in QI projects and initiatives, when in fact all of your residents did, and that percentage should actually be 100%. The likely reason the percentage on this question may be low is because residents are not making the connection between an activity, project, or organizational initiative and quality improvement. So GME leaders need to help make this connection until it really becomes ingrained into GME culture. Number 2, teaching rounds. So teaching rounds present an opportunity for faculty to discuss important issues with residents. Incorporating QI into daily teaching rounds allows for a structured discussion on numerous quality issues related to patient care. You can standardize teaching rounds and add a QI component to your rounding structure that's already in place. Present the patient, plan of care, and address a specific quality or patient safety issue. So for example, readmissions is one quality indicator. Let's say there is some organizational initiative underway around improving readmission rates. So you incorporate this into your teaching round structure. Is the patient high risk for readmission? How come? What are the issues? What can be done to address and prevent these issues? It doesn't have to be elaborate, just a brief discussion on the patient's susceptibility for readmission and how to prevent. Rounding in general is a highly effective way to engage residents and create that environment of inquiry which the ACGME places emphasis on. Many organizations have deployed some type of interdisciplinary rounds which residents are a part of, and this is highly effective at improving communication among caregivers. Some organizations have even established quality and safety rounds that specifically focus on quality of care and patient safety concerns. Number 3, feedback. Feedback is an important tool that's used in medical education. It's given in real time to provide information to residents on what they did well and what can be improved. The purpose of feedback is to allow residents an opportunity to improve their skills and knowledge. Residents should be receiving feedback from faculty they work with either formally or informally almost daily. So feedback sessions provide an opportunity to facilitate brief discussions on quality improvement. Faculty can incorporate feedback to residents on their ability to identify and engage in quality improvement practices. So an example of this when giving feedback to a resident would be identifying an event reporting opportunity that the resident missed during an observable period, or acknowledging an event report submitted by the resident. Another example would be to include feedback on the resident's ability to utilize resources effectively in order to provide efficient patient care. The test they ordered was appropriate because, or make sure to discuss follow-up care to a primary care physician with patients upon discharge because. These things all tie into quality improvement and will get residents thinking about systems-based practice issues. So just like with teaching rounds, changing the structure of feedback sessions to include feedback on systems-based practice issues or resources can be an effective way to incorporate QI into daily teachings. And this also helps make the connection for residents and reinforce that. Number 4, daily quality and safety briefing. So some institutions have established daily quality and safety briefings, or another word for it is a huddle. If residents are integrated into this at your institution, that's great. The purpose is to identify any quality or safety issues or potential issues for discussion amongst the team. If your institution does not have such a thing, you can at least implement a quality safety huddle at the GME level. Gather the floor team together at a designated time every day or once a week. Doesn't have to be every day as long as it's consistent. Have everyone identify at least one quality or patient safety issue. It doesn't have to be an issue either. You can have residents identify something good they saw or were involved with related to quality or patient safety. And this can be done in the outpatient setting as well, say in a continuity clinic. Integrating this into both the inpatient and outpatient settings is actually beneficial because there can be very different quality, patient safety, and systems-based practice issues that arise in the two different settings. The huddle may also be used to identify event reporting opportunities. So despite efforts to engage residents in reporting events, data from the ACGME's First Clear report suggests that there is a lack of event reporting from residents. So a quality safety briefing or huddle can be your opportunity to identify reportable events based on the issues brought forward at the briefing. And then finally, number 5, QI reflection. So I once worked with a clerkship director who utilized journaling as a way for medical students to reflect. And there were no instructions given on what students had to write. They were just required to write once a week, and the clerkship director would review and then respond to the writings. It wasn't graded or anything. It was really intended as an exercise to develop that humanistic side of medicine in medical students and hopefully create a greater self-awareness of their environment and then their role in it. Reflection and journaling have been used for some time as an educational strategy to develop learners. So using reflection as a tool to integrate QI into residency curriculums can be an effective way to develop and improve QI knowledge and processes in residents. So you can do this similar to how the clerkship director I described incorporated this into the curriculum for medical students on her rotation. However, you may want to create a little more structure by requiring reflective writings on some aspect of QI, a QI process, or quality in healthcare. So maybe start by having the residents reflect on what quality in healthcare means to them, how they would define it. I think doing this can also provide insight into what and how much your residents already know, and then can drive the QI educational programs that you put in place in the future. So incorporating quality improvement into daily teachings should not be a daunting task. You want to develop short-term and long-term activities that will help QI knowledge and processes stick. Think about activities such as the ones that I described that you can incorporate into activities you are already doing, like teaching rounds and giving feedback to residents. Eventually, these activities will evolve as your residents become more competent and QI becomes ingrained into GME and your organizational culture.